So there are many downsides of utilization management if it's not used properly. You can imagine, in theory, having some sort of mechanism to make sure that care is appropriate is really useful. But sometimes if you have a restrictive formulary, it means that patients may not have access to the only drug that would be effective at treating their cancer. That's a problem. Similarly, in step therapies, it may not be reasonable to have steps in therapeutic intervention because these drugs aren't therapeutically equivalent. And so step therapy may not make sense in many situations. Also, the prior authorization process, if it's not managed by someone with a deep knowledge of oncology, and if the criteria that they're using for prior authorization are too stringent, it can provide delays in patients getting appropriate care. It used to be that these delays by prior authorization would only take a day or two, but now we see that they can be a week or more for IV therapeutic interventions and up to a month with oral oncolytics. So they can really be substantial barriers in patients getting the care that they need. What we'd like to see, I think utilization management will continue because I think it represents an important part of how you make sure that patients are getting the care that they need. But what we'd like to see is it being conducted by informed individuals with the kind of expertise necessary and the kind of oversight that's appropriate to make sure that cancer patients get the care that they need. We'd also like to see these things happen in a timely fashion and have doctors be a part of the process.